Stand by. We're going live. We're going live. 10, 9, going live. 7, 6, 5, going live. 4, 3, 2, 1.
Welcome to 10 Seconds to Air. I'm Alita Guillen. I start every podcast asking my guests the same question. What goes through your mind 10 seconds before air? My guests love the question because it is a truth teller. It's a moment when our mindset, our training, all our life experiences, good and bad, comes into play, and when we must perform at our very best. How we execute that moment is personal and defines our own communication style. Mastering the art of communication leads to new and exciting adventures. It extends our reach and impact on others, many times adding purpose and meaning to our life and allowing for deeper connections. So what does that have to do with today's guest exactly? Well, listen up. My guest today is renowned orthopedic surgeon Dr. Robert Klapper. As you are about to hear or may already know, he connects deeply with his patients and public through his own communication style. Dr. Klapper is one of a kind, a pioneer of minimally intrusive surgical techniques and tools that have changed the lives of millions of people. He is the director of the joint replacement program at Cedars Sinai Hospital in Los Angeles and has replaced thousands of knees and hips, including many of famous athletes and celebrities. But Dr. Klapper's passions and style go beyond the operating room. He is a marble sculptor, an avid surfer, and for 12 years he hosted the ESPN radio show The Weekend Warrior, giving advice to callers about their aches and pains. Dr. Klapper's stories and advice, medical or otherwise, are thought-provoking, inspirational, and entertaining. He has developed and mastered an authentic and powerful communication style, full of humor and common sense and perfectly anchored by his own life experiences. He joins me now in person to have a conversation about his life, what to do and not to do to avoid surgery, and how the art of communicating has served him well. We pick up the conversation talking about his parents, a topic he often shared with listeners on his radio show. Be patient, we do get to the 10 seconds to air question, but we broke format because Dr. Klapper was mid-story, and as you are about to hear, you just don't want to interrupt him. Here now is my in-person conversation with Dr. Robert Klapper.
But a lot of times I would talk about my dad, the carpenter, and how he fought in World War II, worked in the post office, but he was a carpenter, and how he always felt that he was a failure. And it bothered me so much because I love my father. And it was interesting. My mother, when I was probably 11, 12 years old, said to me, "So, Mr. Big Shot, what are you going to do with your life?" I said, "I want to be a carpenter just like him, a rare Jewish carpenter. The last Jewish carpenter was named Jesus." I said, "I want to be like him, build things, work with my hands." She looked at me. My mom was a nurse. "Robbie, do me a favor. He can't even make a living. He is a failure. He can't do anything. I got to go to work to support the family. Robbie, do me a favor. First, you should be a doctor. Then you can do whatever you want." And so I love my parents. I respected the hard work and what they did. And there were other reasons why I went to medical school, but that was a big one. I mean, my mother felt that her life was such a struggle. So the great joy, if she wants to have a son that's a doctor, okay. And then I go to medical school. I don't know from nothing. I just know my mom's a nurse. Well, I went to school at New York at Columbia for college and for medical school. So here I am in medical school at Columbia, and they did something really great. The very first year, and you don't know nothing, they have a cadaver. And there's 5 people around a body, your classmates, and you start at the top. You do the dissections of the head and neck. Well, what did Columbia do? They made the head of ENT surgery come to the cadaver and teach you. We make our incisions this way, not this way, because the recurrent laryngeal nerve wraps around the thyroid. So when we do thyroid surgery, we have to protect the nerve to the voice box. And this is why, like, they made relevance to the dissection. It was awesome.
Yeah.
Okay? And you don't know anything because you're a first-year student doing the section. Well, the next week, now you're in the chest as you work your way down the body.
Yeah.
The heart surgeons come in. We cut the sternum this way to get to the heart. You know, all this. It was amazing. But I'm not necessarily going to be a brain surgeon, head and neck surgeon, but it was all fascinating to me. And I'll never forget this. 6 weeks into it, we've gone through the belly, general surgeons, vascular surgeons. 6 weeks into it, we're at the pelvis. Only this lecture was in the big lecture hall, not at the cadaver.
Why is that? Why is that?
Because he was an egomaniac. The chief of orthopedic surgery, Frank Stinchfield, who brought hip replacements to the United States from England. I'm sitting there in this, with all my 150 classmates at Columbia, in this big amphitheater. And he's way down below. And the guy comes in with his white coat. And he goes, Gloria, please come this way. This is Gloria Sanchez. She's wearing a mini dress, stiletto heels, this amazingly attractive Puerto Rican lady. He takes her hand and she does like a spin with her mini dress and her stiletto heels. And they do a little salsa dancing on top. I'm going, what the hell is going on?
Yeah.
He puts up a slide. He goes, Gloria was born without a hip. It was dislocated since birth. She had no ball. She had no socket. And I'm like going, whoa. So I used a saw to cut the femoral neck and head off. But I saved it. And I drilled into it with a drill. And then I used screws and bolted. And I made a roof out of a flat wall of her pelvis so that I could put the socket, the acetabular component in. And I created a hip. Gloria could not walk. Look at her now.
Wow.
And I'm sitting there going, saw, drill, hammer.
Yeah.
Oh my God,
Yeah.
I could be a carpenter in the body. I never knew this. It was like amazing. I looked at the guy to my left. I go, this is a problem. The whole class, everybody's going to want to do this, right?
Yeah.
The guy looks at me and goes, no, I don't want to do this. I want to be a pediatrician. I go, you're crazy. Okay, I looked at the guy to my right. I go, oh my God, the whole class is going to want to do this. This is crazy. He goes, I don't want to do that. I go, why? He goes, because I want to be a psychiatrist. I go, you're really crazy.
Yeah.
And I never realized it was as though Cupid flew into the room, took out his bow and shot me in the chest.
Yeah.
And when you go to medical school, particularly the military aspect of surgeons, you know, it's abusive, it's rookie, it's hazing. I should write a book one day of what it's really like to be trained in this country as a surgeon, probably all over the world. Militaristic. But to be, and again, I'm naive. I don't know how this whole, my father's not a doctor. I don't know how this works. But this is how it works. When you start your clinical rotations, like general surgery, your third year of medical school, particularly in these county hospitals, which is where I was at, there you are with your chief resident, the attending you can't find. The person needs an appendectomy, let's say, because they have belly pain in the middle of the night, whatever. And there you are as the medical student. So Klapper, the chief resident, the big shot says, what are you going to do? The correct answer is, I'm not sure yet. Okay, here's the scalpel. You can do the appendectomy and I'll take you through it. What I would say, because I was naive, okay, Klapper, as they're about to give me the scalpel to do as a third year medical, the appendectomy on this godforsaken person, they would say, Klapper, what are you going to do? I said, I'm going to do orthopedic surgery. Well, then I'm not giving the scalpel to do this appendectomy. And I would go, I don't care. I don't want to do your appendectomy. I only want to do orthopedic surgery.
Yeah.
Like I was tunnel vision.
Wow.
And it would be a problem because you're supposed to be, you know, learning all these different other fields.
Right.
I could care less. From that moment that lecture occurred, that's all I wanted to do. I realized with that Cupid's arrow in my chest, this is an unbelievable opportunity to combine my carpentry with my mother, the nurse.
Yeah.
And that story is over 40 years old.
But even before that, when you were an undergrad, you were not a chemistry major. You were not a biology major. No. You were art history.
Yeah.
I mean, you're so unconventional at every turn.
Yes.
What got you into art history?
So I'm going to give you the long story because this is your podcast.
Because we got time.
So my father worked at least 16 hours a day. he would come home for a half an hour to have dinner and then go back to the post office. So he had to spank me and kiss me all in the same meal, right? Because of whatever, I set something on fire in the backyard, so I was in trouble for that.
Right.
But he also hadn't seen me, so he had to spank me and then kiss me all at the same time. This was my life with my father, right? But once I got to be 7 years old, 8 years old, I mean, I'm strong, not because I went to the gym. I would schlep my father's tools into the homes of the jobs he was doing as a carpenter for the other 8 hours. 8 hours in the post office, 8 hours as a carpenter. And we lived in the poor section of town. And we struggled to even be in that lower middle class neighborhood in Far Rockaway. But the rich people lived in the 5 towns: Lawrence, Woodmere, Hewlett Harbor. And my father, if he was lucky, got to redo the basement or do the roof or redo the kitchen in the rich people's houses. So from a really short time in my life, beginning of my life, I should say, I would be on a Saturday carrying the wooden crate boxes where his saw and his drill out of the truck into the rich people's houses. And when I would walk in as a 10-year-old, he would look at me and say, "And Robbie, don't touch anything in this house. Don't break anything in this house, because a doctor lives here, a lawyer lives here, or this one or that." And so his feelings, because he never went to college, he grew up during the Depression. He was born in 1915, so they had me later in life, in their lives. They had 3 daughters, they had a son who died, and I was kind of like the rebound that happened. So in my mind, I had to actually kill someone to be born, because this poor kid didn't live to past 10 months, so they had me on the reap. So this was in my head. Why did he die? How does the body work? So I always really was fascinated by medicine subconsciously because of that. But anyway, don't touch anything here. We're the B team. Yeah. We're the B team. They're the A. We work for the A team. Okay, This is his mentality. Yeah. Because of inferiority complex of not having a full education, even though he would do the New York Times crossword puzzle in pen. But that's a whole nother story.
Wow.
So that's how I grew up, with a B team. Okay? 1968, Mexico City Olympics. We have a black and white TV with the rabbit ears.
Yeah, I remember those.
We lived across the street from Jamaica Bay. Mm-hmm. And my only way, because what I'm not telling you is the fights my parents would have, because money was always missing. Mm-hmm. And you're a failure, you can't do this, how'd you lose all this money, whatever. It was really awful. So to escape, I would go across the street, and my mother made the mistake of reading me Tom Sawyer and Huck Finn as a young kid, because I wasn't reading. She thought I was, going to be a real problem in terms of education. And I remember listening to that story going, Huck Finn, the Mississippi River with a raft, a whole bit. So I would go to the bay and I would build, and this led to ultimately getting a rowboat. And I would be out on Jamaica Bay in the traffic of the big barges near JFK Airport, nearly getting killed many times. That's a whole nother bunch of stories.
Where were you going?
I was just rowing and fishing and rowing by myself.
To get out of the house.
Just to get out of the house. Yeah. But I learned to fall in love with rowing. So it's the 1968 Olympics. Remember the scene of Tom Cruise with the socks and Risky Business and he goes sliding? Yeah. Okay. My father's watching the 68 Olympics, track and field, gymnastics, when all of a sudden on the black and white TV is the crew team, the rowers. Yeah. I stopped in my socks like Tom Cruise and I went sliding. And as I'm sliding, I blurt out, "Oh my God! Rowing in the Olympics. I'd love to do that."
Yeah.
My father turned. Again, I love my father. He turned. He said, "I'm sorry, Robbie, you can't." I said, "Why?" He said, "Because the only people who do that go to Ivy League schools. And no one from this neighborhood goes to Ivy League schools. So you can't do it." And then he quietly turned his head and he kept watching the Olympics. And I remember, like it was yesterday, I'm 66 years old in a few weeks, being that 11-year-old kid going, "It's enough. I'm tired of being the B team. I can't touch anything, do anything. We work for them. I'm not doing this anymore. I have no idea what an Ivy League school is.
Right.
But in my mind, I'm going to go to one of these schools so you can stop thinking you're the B team. You may think you're the B team, but you're going to know that you had a son who's not the B team. I remember saying this to myself.
Yeah.
I went to the library. There's no internet. This is 1968.
And you're 11.
And I'm 11. What's an Ivy League school? Harvard, Yale, Princeton, Columbia, Penn, Cornell, Dartmouth, Brown. There's like 8 of them, whatever. And I go to the library, innocent, like with this, notepad. I get the address of these schools. I look up the crew coach of these schools.
This is at 11? You're doing this when you're 11
This
years
is
old?
on, I'm thinking at 11, but I guess whatever you start to apply to when you're 16 or whatever it is.
As you get older.
But I was on the swimming team because my high school had a swimming team. Obviously, we didn't have a crew team. And it was an overcrowded New York City high school. There were 1,200 kids in my class. Not in the school, just in my class.
Wow.
It was insane. But they had a swimming team, so at least I did that.
Okay, so you're looking up the crew coaches.
I'm looking up the crew coaches. Frank Smith, University of Pennsylvania, this one at, Princeton or whatever. And I sit down at my Smith Corona typewriter and I write an innocent letter. And I did okay on the SATs. I was number 19 out of 12. I wasn't the valedictorian, but I think in my high school, number 20 just discovered fire, a Neanderthal. You know what I mean? It was competition, not that great, but I was number 19.
You were 19,
yeah,
okay.
I was number 19. But I did okay on the SATs. I didn't get perfect scores. I am still not getting into an Ivy League school, okay? And I know this. So I sit down and I write a letter. Dear Frank Smith, University of Pennsylvania, or Yale University. I am a senior or junior at Far Rockaway High School. I'm on swimming, but my real passion is rowing. And I'm curious, what time do you get up to run? How do you train? Because my dream one day would be to row for you, Stanley Steamer, at Princeton University.
Yeah.
And
wow.
I send off this innocent letter with my fakakta application to colleges, which I have to pay for the application. There's no money in my house.
Yeah.
I'm working in the Catskill Mountains as a waiter and a busboy and a lifeguard. I'm doing all kinds of stuff. But I put that letter in each of those applications. And there I am at the kitchen table one day. And I said to my father, Dad, so you can imagine the application now goes in where you're in the office, the admissions office of Yale.
Yeah.
So I sent off the letter. I get letters back
from the coaches.
I remember seeing the mailman. There it was, Princeton University, orange and black with raised lettering on the return on the envelope. Mm-hmm. Yale University, blue and on the whiteout. It was, and the mailman gave me this. I'm going, oh my God! I open it up, dear Robert. I think it's fantastic that you row. This is my passion too. We get up at 5 a.m. We run 5 miles. I hope someday your dream does come true where you can row here at the University of Pennsylvania.
Wow.
I got these letters. So I remember sitting at the kitchen table with my father saying, hey, Dad, so I have an interview at Yale and one at Princeton. This one's in Connecticut. This one, should I take a bus? I don't drive. We don't have a car.
Right.
Should I take a bus or should I take the train from the train station to both? What do you think I should do? My father looks at me and goes, Robbie, this is not supposed to be happening. I have no idea how you did this.
Right.
Where the admissions office is opening up a Far Rockaway High School application, ready to throw it in the denied reject box. But as they open it, there's stationery from Yale University, from Columbia University, from their crew coach. And I never lied. But if I didn't tell you, or you didn't know that I wrote the first letter, you would think, admissions office, our crew coach wrote this guy a letter. They must be recruiting him.
Yeah.
So I'm sitting there and And he looks at me and goes, this is not supposed to be happening. We're the B team. Robbie, you're on your own. You're going to have to figure this one out yourself. The bus, the train. And I remember saying, okay. And he said to me, I love you very much, Robbie, but I can't help you with this. This is beyond my bandwidth. And I remember saying to myself, okay, as long as I have a dad that loves me, I know I'm ahead of everybody else or in the A team. And there I went. So let me just entertain you with one story. I'm at Princeton University, okay? This school is so amazing that they don't just have fraternities. You know what they're called there?
What?
Eating clubs. These characters not only go to college and stay in a brownstone on the campus, but they bring their own chef. This is like, are you out of your mind? So there I am with my father's voice in my head on like a Friday night, a recruitment weekend.
So you're on a recruiting trip. This is a recruiting trip.
I'm up, at Princeton University. I can tell you other campuses as well. But there I am with this giant King Arthur's Court table with the coach and the crew team and 2 other recruits. There's 3 this weekend.
So
okay?
They haven't accepted you yet.
No,
this is the recruiting
event.
Okay.
And I'm sitting there, and the coach bangs the glass. Okay, gentlemen, I just want to introduce you to 3 recruits we have visiting us this weekend. First, and I kid you, I'm not making this. I couldn't make this up if I wanted to. First, we have Biff Jones from Phillips Andover Academy. This 6'5" I sculpt in marble, okay? This guy is made from Carrara marble, okay? His shoulders are out here, his waist. He's 6'5". He stands up, he looks around. Of course, he looks like every Nazi, okay? You know, with the blonde hair and the blue eyes. And I'm like looking around going, and he looks at everybody, thanks guys for having me. Okay, Biff Jones, and he sits down. And our second recruit, I kid you not, this one was named Biff. This other guy, his name was Chip, okay? We have Chip Stevens. He's from, what high school? Choate Academy. Okay, yep. He stands. He's like 6'4". The muscles are popping out of his shirt. And he looks at her, thanks, guys, really nice to meet you. And he sits down. And he goes, and our final recruit, he says, the coach, Robbie Klapper from Far Rockaway High School. As I'm standing up, I'm looking around going, my father's right. I'm not supposed to be here. This is ridiculous. Okay?
And I'm not 6'6".
Right. And so, guess what? I kissed the mailman because I got into Yale, Penn, Columbia. And when I got into Columbia, I got a really fat letter. And this letter said, you not only have been accepted, we don't have full scholarships or whatever,
right,
but because of your financial situation,
yep.
We've culled through, and his name was Maurice Sykes, who was a hedge fund guy. And at the time, it was rare on Wall Street. He had a son who died, who was pre-med. He was on the 1929 crew team that won the Ivy League championship. And he picked you out of the incoming students, and you will be what's known as a Sykes Scholar. It wasn't a full scholarship, but I got help. And I said, this is unbelievable because I need the help.
Wow.
Oh, my God. And so I went to Columbia. The long answer to your question is, okay, so I didn't go to Penn. I didn't go to Yale. I went to Columbia. If you go to the other schools, there's no core curriculum. Columbia, unique in the Ivy League and unique in this country, they don't care whether you're going to be a physics major, English major, whatever you're going to do with your life. Half your credits to graduate have to be in philosophy, humanities, music and humanities, art, history, okay? I don't want to study art. I never want to even go to a museum.
So at this point, you still are, you think you're pre-med.
I think I'm pre-med.
You're going to be a doctor.
Which was awful because I now am at Columbia as a freshman where all these kids, Bronx School of Science, Stuyvesant, let alone the prep schools that got in, they have AP chemistry. So what did these bums do? They took AP chemistry in their fancy high schools, didn't take the credit, and then were in my class where the professor could barely speak English.
Oh, boy.
I didn't understand what was going on, but they could get an A because they repeated the year. I have no idea what's going on.
Right.
This is why I couldn't wait to take organic chemistry, because I knew you ain't taking organic chemistry in high school. At least then. Now, who knows what happens now?
Right.
At least now it will be all even.
Right,
Not that
level
I'm a
playing-
chemist.
level
But
playing
anyway,
field.
Level playing field. So I made it through rowing on the crew team my freshman year, which was amazing. And bringing my parents to the crew race at Yale was a whole nother story that if you have more time, I'll tell you. But anyway, it was amazing. But I made it. I didn't get A's, but I got B's, which meant I could keep my scholarship. So everybody else is taking their test.
Yeah.
All I'm thinking is if I don't get a B, they're going to take the money away and I have to drop out.
Yeah.
So talk about pressure.
Yeah.
But I made it. I got all B's my freshman year. Now I go to begin my sophomore year and I got to take these ridiculous core classes regardless of what I want to study. And so here I am, sophomore year, first semester, sophomore year, art history. The professor, David Rosand, who ended up becoming the chairman of the Department of Art History at Columbia, which is like the greatest art history department in the country. I didn't know this. All I know is I'm stuck in this class. So I have to take this class. So I go there the first day, 35 kids in the class, whatever. Nice small class. And then there's the professor. And the very first day I come in, I got my knapsack, I put it down, and he puts out the lights, which was kind of cool, I guess. And he puts up a slide. But before he shuts the lights up, before he puts the slide up, he turns to the class and says, oh, by the way, I hope none of you are pre-med because I don't give A's.
Oh, boy.
Look, I'm going, oh my God, I'm not here to learn anything.
Right.
I'm here to get into medical school and I'm wasting these 4 years because this is what the deal is. I would love to be like a plumber. You're an apprentice for 10 years, then you become a plumber. That's what just hang out with an orthopedic surgeon for 10 years. No, but that does not how it works. I have to take these ridiculous classes that have no relevance to being a doctor.
And you need an A.
And I need to get an A compared to these guys who already took an AP class. So anyway, this is what you're up against. This is an impossible dream, right? Didn't they have that? To dream the impossible dream? This is an impossible dream. So he says, and I don't give A's. And I'm going, I got to get out of this. I got to transfer, whatever that is. I literally start putting my notebook into my knapsack. He shuts the lights off and he puts up the first slide as I'm putting my books away because I got to transfer out of the class. It's a painting by Renoir. And he says, now I want you all to see in the corner of this painting the visual noise he's put into this painting. And I remember sitting there going, as I'm putting my books into the knapsack, visual noise. In Far Rockaway, you get arrested if you put those two words together. You're not allowed. Visual you see, noise you hear. You can't put this together.
The police are coming.
The police are coming. Visual noise. And now on my right shoulder, a little man appears, a devil. And on my left shoulder, a little man appears, the angel. The devil starts talking in my right ear. You got to get out of here. He doesn't give A's. You need to get an A, no matter what the class is. You already got B's the whole first year. You ain't getting into medical school.
Right.
There's no purpose of being a pre-med unless you get the med. The pre-part don't count. You can't do anything with a pre-part, right? Pre-life.
Right.
So then the angel starts speaking to me. Did you hear what he said? He put two words together that you've never heard before together. Robbie, this is the smartest man you have ever met in your life. You're here to learn something, idiot. You need an education. That's what you're here for. So you won't get an A. You'll get a B. You'll figure it out later. You got to trust it. Just like Steve Jobs says.
Wow.
You got to trust that the end will be okay.
Yeah.
I didn't know from Steve Jobs then, but that's what he said. That stands for commencement speech. You should listen to that.
Yeah, it's a good one.
And that's the voice I had. Probably too late to get out of the class anyway. You need to stay. I put my pencil down. I put the books down. And I made this executive decision to stay. This man was so hard and so intense and so smart. You know, so the final exam is 3 hours. Blue books. Remember the blue books?
Yeah.
Now probably everything's online. Blue books. The final exam, he put up 3 hours, one question.
Oh, boy.
A painting by, you should look this up, Pablo Picasso. It's called Three Musicians. It's a painting that Picasso did of African masks holding Cubist instruments, but instead of their faces, they're African masks. He puts up that painting, and then he puts up another painting, Madame Carpentier and Her Children by Renoir. This beautiful woman sitting on a sofa with her kids as a portrait. And he goes, compare and contrast these two paintings. Blue Books, 3 hours.
Wow.
One question.
Wow.
And you got, wait, this guy is the hardest ass guy you've ever met.
Right.
And I looked at
Wow.
the painting, I looked like, okay. And I opened up the Blue Book and I started. In Pablo Picasso's painting, Three Musicians, the wall behind the musicians is brown. If you look carefully at those three masks where they're holding the instruments,
Yeah.
Picasso did not paint the pupil of their eyes. What did he paint? The brown wall that's behind them. In other words, when you walk into a room and three people are playing music, do you really care what Bruce Springsteen looks like? Do you really care of the identity of the musician? No. They're playing something for your ears, not your eyes. Madame Carpentier is paying Renoir a boatload of money for her portrait. And she better look prettier than she really even is. But you better be able to look at that painting and pick that lady out of a crowd in Paris based on that painting. That better be better than a photograph of her. And so I'm saying identity. Picasso's showing you there's no need for it. Renoir's showing you it's all about, and I start writing. And
Wow.
I'm writing. And I get my grade back. And I get my Blue Books back. And he writes on it, A.
Wow. Wow.
And now I go for my meeting, because I'm a sophomore, first year, I have to declare a major.
Yeah.
I get my bar mitzvah suit on because I only have one. And I'm in this crowded lobby waiting for my meeting with my advisor at Columbia. Steve Singer was his name. I bang on the door, I go in, have a seat, and he's got like a million kids to
Right.
talk to, so he
Yeah.
don't have time for it. He's chewing gum, he could care less. Okay, kid, you're pre-med. Okay, what's the deal? I'm your advisor. You got to major in biology, biochemistry, chemistry. It's got to be in the sciences, okay? You understand that? I'm your advisor. That's what you have to do. I go, I just took this class. It was awesome. It was the greatest thing I ever did. And I'd love to study it more and major. It was in art history. He looks at me and goes, son, I'm your advisor. You do that, you'll never get into medical school. It's suicide. And I remember sitting there going, great. Here's another guy I'm not going to listen to in my life. And then I went and took classes in Michelangelo, in art of the American Southwest, about, I could tell you which tribe made which rug. It was amazing. There were three people in the class. The head of the Museum of the Southwest in Manhattan and a lady named Pocahontas. This was in my class. This is who I was taking the class with. It was amazing. But then my senior year was coming. And I really missed the man who changed my life, David Roseanne. And I remember my time at Princeton when I went on my interview, where they told me all about, if you come to Princeton, what makes us different is you have to write a thesis as an undergrad. You have to do like a PhD thesis, even though you're an undergrad. It was like, oh my God. And one guy had done one about how to make an atomic bomb. And he got expelled from Princeton. I remember hearing about that because he actually told terrorists how you can make an atomic bomb. It was crazy. But it was always in my head. So I remember realizing time is running out. I'm going to be graduating. And I miss being with this man who changed my life. So I remember going to his office.
The original class.
David Roseanne.
Yep.
My junior, I said, I'm only here one more year. But you're not teaching. You're on sabbatical. You're this. And he looked at me in his office and he said, if you want, Robert, you can do a senior thesis with me. I said, this isn't Princeton. He goes, I'm the chairman of the Department of Art History. I can do whatever I want.
So you did that.
He looks at me and goes, what are you interested in? I said, I want to use my hands and I want to be in medicine. So I want to be a surgeon. But because of you, I love art.
Wow.
He looks at me and he goes, there was a book written in 1543 by Vesalius. Because up until then, doctors used a textbook written by Galen, a Greek, 2,000 years ago. But they dissected monkeys, animals. They never dissected humans. It was not until 1543 that Vesalius, for the first time, dissected humans. In fact, he discovered the diaphragm muscle because he discovered, and he went on and he goes, but his textbook, his anatomy textbook, was illustrated by a Renaissance artist. Robert, you should study for your thesis the Fabricus by Vesalius from 1543. So I go every week to the New York Academy of Medicine, to their rare book room. Took the subway, and every week I'd spend hours studying this book from 1543. I'll never forget this. I've got 20 books on this, and I would go there every week my senior year. One day I go up to the librarian and I said to her, there's a reference for this particular book. She goes, I've noticed you've been coming here every week for 3 months. What are you doing? I said, this, and I tell her the thesis and I'm trying to get at this book to understand it from an art historical standpoint, from a medical standpoint, and she looks at me, she goes, would you like to see the original? I said, original? There's only 6 copies original in the world that remain. 2 are in the Vatican. One's in, she goes, I think we have one in the vault. I looked at her and go, are you kidding me? Let me talk to the head librarian and see if we can take it out of the vault for you to see and use. So she makes arrangements, and I'll never forget, I go one day, this book is gigantic. They bring it out. And you got to realize, I know this book backwards and forwards because I've been studying it. Yeah. But I now have the original. Yeah. So I start turning the pages from 1543. I get to page 100. So there would be a drawing on one page, and then in Greek and Latin, the description of, and as he took layers of the skin and the muscle to get deeper into the body, to the organs. That's what the pages were. Page 100, the right side of the page was not Greek and Latin. It was Hebrew, which I could read. And I oh my God, it was amazing. Anyway, I majored in art history. Yeah. My advisor's voice in my head is suicide. Yeah. You're never getting into anything. Right. Now I go and apply.
And so the whole time you stayed on this path that you're going to stay into medicine.
Into medicine. So now I take the MCATs. I'm with all my friends who've all majored in biology and chemistry and all the rest of it. And I take the big risk and I apply. Miraculously now I get an interview. Vanderbilt, Columbia, University of Miami, Buffalo, coldest day of my life, Erie County Medical Center. Oh my God. But anyway, I remember sitting there in these interviews, and they'd look at me, they go, wait a minute, you're an art history major from Columbia?
Yeah, right.
I've never seen that before. And I'm going, oh God, here we go again. I'm hearing that voice, the stupidest thing you could do.
Were you worried at all, though? Were you concerned at all? No.
I didn't.
No?
Okay. I knew I was going to make my own path. Yeah. I didn't want to be on the B team. Yep. Whatever that meant. I didn't know what the A team was because I didn't live the A, but I knew I didn't want to be on the B team.
But even the people that were in the A team, from Columbia, that is telling you, you got to stay, you got to do chemistry, you got to do biology, you got to do all this. And they know what the A team is, and they're telling you that's the path for the A team, but something's telling you, I'm going to get to the A team my own way. So how's that working out?
Because I loved it so much. Yeah. I love the world of art so much. because it's so arbitrary.
Okay, so you go into
It's
these
not-
interviews.
I go in the interviews, and the guy, I remember one of them, he looked at me, he goes, art is like you. And then he sees, I took all these classes, like one in Michelangelo. And he would say to me, okay, tell me something about Michelangelo. Really? Okay, you want to know? And I would tell him, when David was unveiled, the head of the city of Florence realized the acclaim the artist was getting. And so in front of everybody, while it was being unveiled, the bishop looked at the governor and said, isn't this beautiful? But the governor's jealous that all these people are, wowed by this artist. So what does he say? This is in a letter Michelangelo wrote to his father. The governor looks at the bishop and says, actually, I don't think it's that great. In fact, I think the nose is too big. Okay? You've seen that. Yeah. Are you out of your mind?
Yeah.
But he's like, a politician. We all know what they're like. They're narcissistic, jealous. He actually said that to the bishop. I actually don't think it's that great. I think the nose is too big. The bishop looks at Michelangelo and goes, hey, buddy, it's really great. We all love it. But we got a problem. Because this guy's paying for it. And if he says the nose is too big, you have to fix it. And guess what? You have to fix it right now. Okay? This is a story from 500 years ago. He writes to his father. So when you sculpt, he used to wear an apron, like a fanny pack in front. Your hammer, your chisel is there. And as you work, dust gets all over you, and fragments of the marble get everywhere, including in here. So he writes to his father. So in front of everybody, the unveiling, the whole crowd is there, the dais is there, all the big... Father, he writes, I climbed up the scaffold. I got to the face of David. With my right hand, I took out my hammer. With my left hand, I went to pick up my chisel from my apron. But I scooped some dust in my hand as I did it. And I stood in front of David with the chisel and the dust in my hand, hidden, and the hammer. And he says, and Father, I hit the chisel. And as I hit the chisel, I let go of some of the dust. He said, and then I looked down and said, is it better now?
Oh, wow.
And the governor said, thumbs up. He said, but Father, my chisel never touched the stone. It's like,
right.
You.
So you're telling that story to
I'm
the...
telling the story.
Yeah.
That's like I'm mesmerizing you and all of your listeners with this story.
Yeah.
The guy looks at me and goes, okay, here's the deal. I know I'm not supposed to do this, but if you want to come to this medical school, I'm going to say that you should come. And when it happened, when Vanderbilt did, so in summary, I got into every single medical school I applied to.
But you ended up
going to Columbia.
At Columbia. Stuck with Columbia. Okay, so let's go. Now you're...
How am I doing, by the way?
Amazing. You're amazing. I mean, you're what's not to love? I mean,
Right.
There's so much to talk about. So, but I want to put together, because now I've heard the background, the story, of tons of questions for you. One is about your dad, his response to all of this. I'm going to ask you two questions because I don't want to forget what I'm going to ask you, because I know you're going to have a great story about your dad. The other one is you put together art and medicine and carpentry, and you've got your own patents now. It's like you went and you created. And
Yes.
my question to you is, would you have been able to create without that art history background?
No.
It's just,
No.
it now it makes sense.
I make it all connect in everything I do. So I'm a surfer. What does surfing have to do with this? There are podcasts, there are lectures all about living in the moment. To me, surfing, the nose of the board is your future. The tail of your board is your past. But only the surfer stands in the middle and learns to live in the moment. The metaphors of me simply surfing is life experiences. And I see it. I see God in two places in my life, in the ocean and when I open people up to do their surgery. To me, And that's what I did for 12 years on the radio, not dumbing it down.
Yeah.
I found a topic and I went at it from the world of art, the world of sports. And by the time I'm done with you, if you listen to the podcast, you'll go, what the hell does Eric Clapton and Cream have to do with George Steinbrenner and the Yankees and a knee replacement? If you take a few minutes, I'm about to teach you why they're all the same.
So you got a pass. Most of my guests don't get this pass, but we're like 50 minutes in, and I'm going to get to my first question.
You got a lot of editing to do.
No.
Or do it part one and part two.
No, I don't edit. I like the real deal. I want people to know exactly what happened in the room. You talk to a lot of people. The radio show, you get a lot. You've been guest speaker a lot, lecturer. You bring a big crowd. You surf. You open people up many times a week. What goes through your mind 10 seconds before air and 10 seconds before you have a big surgery?
I am so grateful I'm not nervous. I'm excited. And holy smokes, I pretty much was told my whole life in the beginning, you can't do this. You're not allowed. You're not smart enough. You're not big enough. You're not strong enough. We're the B team. Holy smokes. It's an out-of-body experience. 10 seconds before I do that, I literally can leave my body and look and go, look at you. These people are coming to you for your wisdom, whether it's in art, in sports, or in surgery. But it's for real. It's not fake. You know how this is going to end up. You've seen this x-ray. You've seen what that x-ray means in real life. That x-ray is 2-dimensional and it's in black and white. Your body is 3-dimensional and it's in color. The x-ray is static. Your body is dynamic. These are just tools, but your expertise is to take 2-dimensional, static, black and white information and allow someone to walk again without pain. Holy smokes. So 10 seconds before I go, don't get full of yourself. You're still the kid from Far Rockaway. I saw in someone's memoriam, they said, in the train ride of life, I got a window seat. That's what I got.
Amazing. It's unbelievable how appreciative you are and how connected you are to both your past and your present.
Yes.
And your ability to then communicate that and give that to people, whether it's in a lecture, whether it's here on the podcast, or whether it's doing surgery.
Yes.
How many surgeries have you done?
Over 16,000.
And you enjoy?
I was in surgery yesterday, and many of the patients, I've done their left knee. Now they need their right knee, or they're not going to be the same. Same surgeon, same parts, same person. And I tell them, look at your hands. Your right thumb's bigger than your left thumb. Never take it for granted. And I don't. The fact that that person is saying to me, Dr. Klapper, I'm going to go to sleep. I won't be able to be voting. I trust you. You do what you think is best is an unbelievable privilege. And just the fact that I have a sixth sense. Listen, you're doing this podcast. You've been in this business. What you know ain't in the book. I don't care what you do for a living. Right. You're IT, you're an electrician, you do something 10,000 times.
Yeah.
It's not in the book anymore. Well, how would you like to have that intimacy but how the body works. My staff, I have 9 employees. I'll go in the room sometimes and I'll start talking to a patient. And when did your mom die of breast cancer? And they'll stop and go, Dr. Klapper. And she'll say, 10 years ago. And then they'll stop and go, Dr. Klapper, she never told you her mother died of breast cancer. How did you know to ask her, when did you? That's how connected you can get. I don't know what connects all those dots, but my mother was like that as a nurse. She had this sixth sense, and it's been unbelievable to be in medicine, to see through the skin. The marble that I work on, people are fascinated. It's a block of stone. How do you see the figure trapped?
Yeah.
The only person really to visit Michelangelo in his studio was his biographer, Vasari. And he used to say, going to watch him work was as though a woman was nude under the bath water. And what he did was he would walk in and pull the drain plug, and as the water would recede, the figure would appear. What a beautiful way to describe it. After doing so many hips, knees, shoulder surgery, taking care of the body, if you tell me what hurts and why and when and the history that I get, and then I take my hands and I feel the bony landmarks, your acromion, your coracoid bone, that I can feel with my hands. I've done so many surgeries. It sounds crazy to say it, but I can see through the skin like I can see through the block at the figure that's underneath. But I still don't take it for granted. I still respect the process. But those surgeries I did yesterday were the greatest that I've ever done because of the backstory of what I've done before.
What are the most common surgeries that you do?
The number one body part I operate on is probably the knee, from fixing your ACL, your meniscus, and I do hundreds of knee replacements. Followed closely by hip surgery. I do a lot of hip surgery. And it's funny, I do a lot. Most guys, if they do hips and knees, that's it. They don't do sports. They don't do. But again, I'm different.
Yeah.
So I still do a lot of sports, a lot of athletes, and I love shoulder surgery. And the reason I love shoulder surgery, if you want to know, I'll tell you.
Yes, of course.
Because so much happens in your life that you should not fight. I learned this as a surfer. You get out there and there is a riptide. Very good swimmers, very good surfers that I've known about have died. Because if you fight it, you will drown. What you need to do is relax. It may take you a mile up the beach, but it'll stop, and then you can just walk up the beach. So don't fight. Realize it's a message to you and take it. So at the Hospital for Special Surgery, where I proudly trained from 1984 to 1988 and invented tools that are used all over the world, including on the Pope, which is pretty good for a Jewish kid from New York.
What do you mean? What do you mean? The
Pope John Paul II,
yeah,
the Polish one, the one everybody loved. I guess everybody loves all the popes, but this one in particular. He fell, broke his hip. They put a prosthesis in. It got loose. The tools I've invented are specifically for revisions, if you have to redo someone's hip. And so the company that I licensed my patents to for these tools, these ultrasonic chisels, sent a letter to Indiana, to Biomet. Tell Dr. Klapper that the Italian surgeons are using the ultrasonic tools that he invented on the Pope, which is unbelievable.
Wow, that is unbelievable.
Where was I?
Where were you? I'm thinking about, because I've got so many more questions, so I'm just going to throw in the question. Let's go back to your dad for a second.
Yeah.
What did he say? I'm assuming he's passed.
He has.
He got to see your success.
Yes.
What did he think? What did he say?
It backfired on some level. He obviously was very proud of me. He couldn't believe I could do all of these things. But on some level, I felt like I now got to the A team, but I didn't bring him with me.
Oh.
He stayed as the B team. And with that all being said, in the mid-90s, he called me from Florida, and he said to me, I can't walk anymore, Robbie. My knee is killing me. I said, walk in the pool. I've written books about this. Come on. Don't let them give you cortisone shots, and definitely don't go to a doctor in Florida. I said, that's where you go if you know, whatever. So,
Oh, boy.
and he said, I can't take it anymore, Robbie. So you got to realize, I went into practice in 1989. I'm already like 5 years into being busy doing all these surgeries. For other people, there's no way I'm going to let him go to another surgeon.
Right.
Because if they do anything not right, they don't measure twice, cut once, which is what he taught me as a carpenter, I would kill the guy. But here's the problem. You can't operate on your own father unless you're Robbie Klapper. So I sent them round-trip tickets to come to LA. And I hope there's a statute of limitations, but I did my own father's surgery. And it was the best thing in his body. And it gave me I had 3 other orthopedic surgeons in the room in case emotionally it would bother me. Guess what? It didn't bother me.
What'd you do? You replaced his knee?
Yeah. And he went back to Florida and lived many, many more years, but he didn't have a knee that hurt anymore.
Yeah.
And for me to be able to, and I just tell you one other story. So it was hard. He had such a hard life. He struggled.
Yeah.
I'm a little kid. Let's go back to me being 8 years old. And one day at the kitchen table, because I got to see him for dinner and on the weekends, he was the happiest I ever seen him. I said, Dad, what happened? Robbie, you're not going to believe this. I said, what? There's no journal. There's no conventions to go to. How do you keep current as a carpenter in the 60s? The lumber yard. He said, Robbie, I just came back from the lumber yard and I saw the greatest thing I've ever seen. I said, what? He said, Robbie, when you helped me, we have those wooden studs. And in the 60s, a 2x4 was 2 inches by 4 inches. Now, it's like the tuna fish. It's not 7 ounces anymore. It's 5 ounces, right? Everything has changed, mostly to get shorter, right? A 2x4 is not 2x4. And they're not made of wood anymore, even. But in those days, it was. And so when you have to mount the outlet box into the stud, my father took a pencil from behind his ear and mapped out the outlet box on the stud, made pencil marks, and then took a chisel. And it took him 15 minutes, and he cored out in the wooden stud the space for the outlet box. He looks at me and goes, Robbie, guess what I saw? I don't know, Dad. Why are you so happy? There's a tool. It's called a Milwaukee Sawzall. It's a blade that goes this way. It reciprocates, oscillates. And the blade you can stick. It's not like a round saw, the blade. It's this way. And you can go zip, zip. Robbie, I can cut into the wooden stud. I can put that out. It takes me now 20 seconds versus 15 minutes. And I remember saying to myself, oh my God, this is what I got to do with my life. That this tool can make my father so happy.
Right.
You know what I want to do with my life? I want to make tools that make people's lives easier.
Yeah.
So I still have in my house, he couldn't buy it new, he couldn't afford it.
Yeah.
He bought a used one. I still have the red rusted box with the original used Milwaukee Sawzall that changed his life.
Yeah.
And that's why I have patents for surgical tools. So I have to tell you one other story. So when you work at ESPN, you can call Obama if you want, and he'll answer. That's how I always felt. Yeah. So I have a producer, Jared Abrams. Okay, Dr. Klapper, tell me who you want as a guest. I can deal with the neurosurgeons. I can get the Getty Museum. I know everybody there. So the art part, the surgery part, no problem. But the other part that's fun, that's out there, and I have William Shatner, my patient as a guest, Dustin Hoffman. I mean, Tony Danza would call in. I just want you to know, my knees feel great. I'm walking across Fifth Avenue. He'd call into the radio show. Bye, thank you, Tony Danza. It was amazing. I I had a wild, lovely time with the greatest guests. Otis Williams, who's founded the Temptations, was a guest of mine. Mary Lou Henner. I mean, these were all guests on the radio. That was no problem. But Jared Abrams, okay, Dr. Klapper, who do you want to get? And I'm ESPN. Like I say, I can get whoever I want. One day I go, Jared, you know who I want to get as a guest? And Jared was amazing. He could get anybody. I want you to get the president, the CEO of the Milwaukee Tool Company. Because I want to tell him the story that I just told you and how much that damn tool's changed my life. Okay, Dr. Klapper, I'm on it, right? I don't know, a month goes by. Oh, he's a tough one, Dr. Klapper.
Get out of
He's
here.
a tough one, but I got him, okay? Steven, oh, he's going to kill me. I don't remember his last name. It's in my phone. I could look it up. But anyway, he's the CEO of Milwaukee Tools. So I get the phone number. And I go, hi, I'm Dr. Klapper. I work at ESPN. Oh, I'd love to have a show. I love you. And like a week goes by, 2 weeks go, 3 weeks. I'm seeing patients. My phone goes off. He's calling me back. He says to me, Dr. Klapper, I don't want you to say anything right now. Let me just talk. That's what he says to me. I got a brother. He's a banker in Beverly Hills. Every week, my brother calls me and says, you got to listen to this guy on the radio. He says, so first I want you to know, my brother will be so happy to know that I'm actually going to come on your show as a guest. And he comes on the show and I tell him the story. Ever since then, every week, every month, if you came to my office, like your room right now, you can't walk because I have so many Milwaukee tools that he sends me. Oh,
that's so funny.
So there you
that's
go.
so funny. So the inventions that you've come up with are to minimize the surgery, to minimize the intrusiveness, I'll say. Trauma. Okay. You, it's interesting because as you've done all these surgeries, as many of the surgeries that you have done, people kind of know you as a guy to avoid surgery, that will tell you to avoid surgery.
Yes.
Why?
Because I want to treat people the way I would want to be treated. Don't have a cortisone shot. Don't let them talk you into the miracles of this stem cell and it. No. You better ask about the side effects. Be holistic. Walk in the Pool. My co-author, Linda Huey. We've written 3 books together. Heal your hips, heal your knees. Who better to tell you how not to have, I don't want to have surgery.
Yeah.
Who better to tell you how not to have surgery than a guy like me?
Yeah.
I'm not trying to be a contrarian. I'm not trying to be cool. I'm not going on the radio to hustle patients. I'm busy. But you need someone to tell you the truth. The softest pillow to sleep on at night is a clear conscience. You care. I care. Guess what? Not everybody else cares, including people in medicine. So I love people. They wait months to get an appointment with me. They come to see me, finally. They've seen 3 other people. You got to have surgery tomorrow. I look at them, I go, there's no clock. You're not making surgery harder for me to do by waiting or harder to recover from. Get stronger. You may be able to avoid surgery if you make your quad, your hamstring, your calf muscles strong. Less stress in your knee joint. There's so many people I have told, stay away. Guess what happens? They go back home, they have dinner. Guess what? I met Dr. Klapper. I finally got to meet him. You know what he told me? I don't need surgery. Your surgeon said you don't need surgery. 5 other people come. And guess what? These people can't walk. Okay, that's different. But I still want them to do the pool beforehand so that their recovery will be easier.
Okay, so knees, hips, shoulders. Let's
But
say.
the number one person I see, because I'm a general orthopedic surgeon, I love foot and ankle problems. I don't love back pain. Nobody loves back pain. But the number one person I see is someone whose back hurts or their neck hurts.
Yeah.
Because now is the shoulder pain coming from a pinched nerve in their neck, or is it coming from their rotator cuff? You need me to figure out what's the matter.
Yeah.
Or their hip pain. Guess what? Not everybody with a bad hip or hip pain has a bad hip. They have hip pain because the L2-3, L3-4 nerve in their lower back is the nerve that feeds their hip. So many people have had back surgery mistakenly when it was their hip causing the pain and vice versa. You need the depth of understanding of connecting it all. And you need to be a good nurse.
To
That's
yourself,
what
you mean? To yourself.
people, though. To be, yes,
Are
I'm
you
a
saying
surgeon.
you're talking about yourself.
Yes,
you
but you need to treat them like my mother treated people, with caring, and let's do everything we can to not have surgery.
So let's talk about that just for a second. Let's do everything we can to not have surgery.
Yes.
As people, weekend warrior, love the name. That's it's really what so many people do, right? They work all week.
Right.
They're not in great shape. They go out, they play tennis, golf, basketball, whatever. They want to still do it at the same rate that they did it when they were younger.
I'm going to write another book.
Yeah.
Stop exercising. You're killing yourself. And then it'll say, let me explain.
Yeah. Explain that. Explain that.
Our society is polluted with the drug companies. They would rather find a drug for your cough than find the drug for what's causing the cough. Mm-hmm. Everybody wants to feel that you get younger by running. Okay, you don't. Everybody wants to eat whatever they want to eat and then exercise the calories away. Don't work that way. You don't get younger and you don't lose weight because of this. How many patients I have. So I do hundreds and hundreds of hip and knee. These are weight-bearing joints, knee and hip implants every year. Thousands, right? They're not in your grandmother. They're in you.
What do you mean?
37-year-olds, 42-year-olds, 48-year-olds. This is who I'm doing hip surgery and knee surgeries on. Not your grandparents who just wore the joints out. Why? Because we live in a society where if your knee hurts, you take Advil and you keep going to the gym to run on the treadmill, but now you don't feel it because it's deadened by the drug, but you're still doing more damage. That's what I live with. That's the society I live with. No, I actually love pain. What? You're interviewing a doctor who says he loves pain? Yeah, because it's the only information your body gives you that it doesn't like. Now, your next door neighbor who runs like a gazelle with perfect technique, egg isn't egg. They could run. They're not going to injure their knee. But what about the fat schlub that you see at the red light running up next to you? You're in your car, who's overweight, whose arms are flailing. I look at this guy going, I should give him my card because he's going to need me soon.
Oh, God.
Everyone's either pre-op or post-op.
Oh, my gosh.
But
okay, so what does that mean? That
means I should trademark the term. We can do it right here on your podcast.
Okay.
Here's the term. Agercise.
Agercise.
What does that mean?
Yeah, what does that mean?
That when you were 20, pretty sure you can go to the roof of this building, jump, you would land on your car, wipe your arms off, and keep walking. When you're 60 years old or 40 years old, you ain't jumping off this roof, landing on a car. You're going to break something. So what you do as exercise, in your head, you're still 20, but you're not. So you need to exercise differently. Fall in love with the pool, the bike, the elliptical. Yoga, but not every position. Pilates, mat Pilates, not the reformer. Women, for their osteoporosis, Tai Chi. It doesn't hurt the joint. It loads the bones. Beautiful. I love it. And obviously the pool.
Okay, so you just said something that I've never heard before. Don't load the joint.
Correct.
So
because that's what destroys the cartilage.
Okay, so as you're getting older, you're saying running, you're loading the joint. Unless
Correct.
you've got perfect form and you're one of these people
so for this interview, stop running.
Okay.
So here's what I hate for your listeners. Treadmill, lunges, squats, stair machines, weights for your legs. Hate it. Make a living from it.
Wow.
I love the pool. I love the bike. I love the elliptical. I love Pilates, mat Pilates, not the reformer. I love yoga, not every position. And I love dancing and Tai Chi.
Wow.
For balance and bone density.
You're talking to someone who struggles with running, not running, not running.
Stop it.
Yeah.
Get by yourself. You don't need a fancy thousands of dollars bike. Get a Schwinn spinning bike. And I don't work for the company. I don't work for any company.
Yeah.
A few $100s, have it in the house 3 days a week, half an hour, ride the bike. And at this age, past 40, whatever exercise you choose, even the good ones I just showed you, do a half an hour. Stop. Well, Dr. Klapper, I paid the 45-minute hour class. Good. Get off the bike at a half an hour. Because after 40, your brain, your body sees the same. Okay, I got the message. This is a good exercise for half an hour. But you should now go do something different for half an hour. Blocks of half an hour. Don't force it down your body's throat, because then you get overuse, you get carpal tunnel, you get lateral epicondylitis, tennis elbow, you get all kinds of overuse syndromes. If you do the same exercise every day and you do it for an hour, you're going to hurt yourself, not help yourself.
Okay, talk about, set this straight for me, please. The ice, the elevate, the ibuprofen, something hurts. You say you like pain, feel the pain, but ice, heat, ibuprofen,
Here's the answer.
what
It's really
do you
easy.
do?
Acute injuries. You just tore something, ripped something, hurt something.
Twisted your ankle on the tennis court.
Ice. You need to and it's for real reasons. The Klapper vision is the pipes in your body, your arteries, are not the pipes in your kitchen. The pipes in your arteries have smooth muscle around them that respond by vasoconstriction. So ice makes it cold. Guess what happens? It vasoconstricts. If there's less piping of blood, you will get less swelling. So for an acute injury, you want vasoconstriction. Ice does that holistically. If you say, I feel this is a chronic problem that I have, my back hurts or whatever, then heat is nice because it increases blood flow. It causes vasodilation. The same pipe can either squeeze or dilate. If it gets more blood supply to a chronic injury, it helps with healing. But I'm a big fan of, if you do heat, you should still follow it up with ice afterwards. So alternate.
Okay. And what about the ibuprofen?
You got to be careful. I mean, obviously, your kidneys do not want that stuff because it gets taken up by the kidneys. And your kidneys, you only get, 2. And you mess them up, you're not going to. And my wife always says, I never answer the question, so I'm going to answer your question.
She says, I think you're doing great.
Alonzo Mourning, famous basketball player.
Yeah.
Sean Elliott, famous basketball player. They took so much ibuprofen so they could play basketball.
Yeah.
Sean Elliott, I think, had a kidney transplant. So there's enough said.
So
Does everybody who takes ibuprofen get that? No, but it should not be seen as an M&M candy.
I think people overuse it.
For sure.
Oh. I want to go right to surfing because we have not talked about that yet. You mentioned it. How'd you get into surfing? Let me guess. It's a story.
So I needed to go to work to pay for college, to pay for med school, and I did. I worked in the Catskill Mountains. I didn't have a driver's license. I hitchhiked the Tappan Zee Bridge. Now I think they call it the Mario Cuomo Bridge, but Route 17 up to the Catskills, because that's where I can make the most amount of money. Biggest bang for the buck. I got my high school principal to let me only go to school 4 days a week. I don't know how I pulled that one off. So my second semester, senior year in high school, I could hitchhike to the mountains and work as a bellhop, check in for the hotels, and work as a car hop and then a waiter and whatnot, and come back so I could go to school on Monday. It's crazy. But that's how I assembled money to pay for school. And I mean, not just tuition, I had to pay the rent and the whole bit because that's the house that I came from. So now I am working in college, pre-med, organic, you can only imagine. Well, Christmas vacation, I work. During the week, I work at school. I got a job as the bowling alley mechanic. Why? Because there were no on-campus jobs anymore. There was only one job left that was available. And as the girl who looked at me and said, what part of there are no jobs on campus do you not understand? And I said, can I just see the book anyway? She goes, yeah, all of these jobs are taken already. She goes, the red means they're taken. So I said to her, you mean the green means it's still open? Yeah. So she pushes the book. She's chewing gum. She could care less. She ain't helping me. Okay. So I open up the book. Everything's red except one tiny little piece of paper was green. Bowling alley mechanic. Ferris Booth Hall. They had 3 bowling alleys. For the last 5 years, 2 bowling alleys worked, 1 was broken. I open up, I go, here's a job, this is green. Yeah, it's green. It's been a green one for 5 years because it's to be a bowling. She looks at me and goes, are you a bowling alley mechanic? I said, yes, I am. Okay.
I am now.
Do I have any idea how a bowling alley works? No. But I needed a job because I got to pay for food. She goes, you're a bowling alley mechanic. I go, yes, I am. She goes, then you got a job. So I show up the first day. Okay. Everybody's excited. The mechanic's here. We're going to have the 3rd bowling alley. And I'm like, looking behind me. Where's the mechanic? Oh, it's me. Okay. I can't believe it. So what do? I go in the back and I take the back off of the 2 bowling alleys that are working. Have you ever seen the back of a bowling alley?
Never.
There's like 50 what do they call it? Fan belts, and like it's insane.
Yeah.
So I look at the 2. There's like 50. I'm like, great. And then I take the back off the broken one.
Right.
Okay. You turn it, it doesn't work. And I'm looking at these things that are working. Wait a minute. There's a fan belt in these 2, but it's missing one. So, and by the way, it's an hourly wage. It's $4.50 an hour, whatever you get minimum wage at the time in the 70s at Columbia. In about 2 hours, I just matched the belts and then I go to the front, I flip the switch. Holy smokes.
It's working.
It's working. Like, wait a minute. That's $9 that I'm going to get paid. I need this job for the whole... Quickly, I shut it off. I take the belt off, right? And I milked it for the entire... And then the last day, I said, okay, I fixed the bowling alley and I left. But anyway, so money was a problem. So I am blessed because I get to go to medical school at Columbia. I finished the 3 years. Now I'm going to start my 4th year. This is the end of medical school. You actually get the degree, an MD, which is scary. The dean announces the end of the 3rd year. As you begin your 4th year, we encourage you at Columbia to study elsewhere. Each month is called an elective. We want you to go to the Mayo Clinic and Massachusetts General Hospital and all these other places. We encourage that. And all I hear is, I'm exhausted. I've been working all these years in a row. Electives. I have to do electives in orthopedics so that they see who you are, so you can get into programs very competitive. But all I'm hearing is the beach. I do a month elective in August at the University of Miami, Jackson Memorial Hospital. So Columbia, we were busy as a trauma service. We got 12 gunshot wounds a weekend. Thanks to Liberty City and the University of Miami, 12 gunshot wounds a night. I literally remember a guy coming into the ER with a butcher knife sticking out of his chest. And the resident that I was with, I'm a medical student, goes, okay, we're going to triage. He's stable. Let's go do the other guy. I'm like, there's a butcher knife sticking out of him. No, that's not the most extreme thing. I mean, that's how crazy it was. Okay.
So you saw a lot of the beach.
University of Miami. I did not get to the beach once, but I was at least in Miami, and it was intense. Then a month, UCLA. Okay, I don't even know anybody from California, whatever. I come to UCLA, but I did one other elective. Now, I went to the dean's office, or medical education office, and I look, and what do I see? University of Hawaii.
Ooh.
Okay. What it's even doing there is really an anomaly because the front page of the elective book says, if you are not a student at the University of Hawaii, do not open this book because these electives are not for you. They're only for our. I don't know what the book was doing there.
Yeah.
What do I know from Hawaii? I know Hawaii 5-0. That's it. I don't know anybody who's ever been to Hawaii. All I know is in the world of beaches, this has got to be the greatest beach in the world, right? I don't even have anybody to interview. So I spring into action. I open the book, and they're so smart at the University of Hawaii. They don't want people like me visiting. So the elective at every other program is the 1st of the month to the 31st. It's a month, not the University of Hawaii. It's the 14th to the 14th. But I get a month vacation my 4th year of medical school. So I box the month of March and the month of April, my vacation month, so that I can actually go from March 14th to April 14th. And at that time, you could dial 9 and get an outside line. So again, in my whole life, I've never lied. I've never said something that I've just let you make assumptions.
Except with the bowling alley.
Yeah.
But
Well,
you bend the truth a little
I actually was a bowling alley mechanic, so I didn't lie. But anyway, I take the book and I see it's in cardiology. I don't want to be a cardiologist, but that was the only one that fit March 14th to April when I could do this. So it says elective in cardiology, Dr. Alfred Morris. It's actually his name. And a phone number. So dial 9, I called him up. Hello, Dr. Morris? Yes. Never lied. I'm a 4th-year medical student. Oh, great. Do you have any openings for your elective March 14th to April 14th? Yes, I do. What is your name? Robert. Okay, see you in March. Never told him I was not a University of Hawaii medical. He thinks I'm a University of Hawaii medical student because I dialed 9 from Manhattan, okay? I drained, by the way, this is the answer to how'd you get into surfing question.
Yes.
Okay.
I'm following you.
So I'm so excited, even though I have no idea. But now I need a place to live. So I get the Honolulu phone book, Kahanamoku Dormitories, which I later find out is a dormitory for young male Buddhists. You know, like, I don't belong in this, but I picked, it said dormitory. So I have no idea where I'm staying, but I made arrangements. And I drained my precious checking account to buy a round trip ticket from New York to Honolulu. I really have no money left. I used it all to fly there. I fly to Honolulu. Now, here's a moral story for your listeners. Don't ever arrive in a city you've never been in at 11 o'clock at night, because it's dark. You don't know where we're heading. But I did, 11 o'clock at night.
Okay.
And I have my suitcase, and I get a taxi, and I said to the taxi driver, here's the address that I need to go to. The taxi cab driver turned around and goes, are you sure that's where you want to go? Yes, that's where I come on. Let's go already. You know, okay, he says, he takes me, drops me off on this. They have bad neighborhoods in Honolulu. This is a bad neighborhood with my suit. And, you know, the taxi takes off. And there I am, standing like Robert De Niro, standing in the middle of the road and looking at this place where they're praying to like a cockroach that's crawling up the wall.
Boy.
You know, and they're all shaved heads, which now is nice, but in those days was not nice.
Right.
And I'm going, these are Buddhist monks in the dormitory. They're probably cooking people like me. I have no idea what's going on in here. I was scared out of my mind. I did not sleep. The next morning, I go to the medical center, Queens Hospital, and the medical tower next to it, to the 4th floor, the cardiology floor. And I go in there. In a Hawaiian shirt. I've only seen doctors with white coats. He's got a Hawaiian shirt, and I'm already going, this is paradise. This is the opposite of Columbia Presbyterian. It's Dr. Alfred Morris. He looks at me and he goes, Robert, you're not a University of Hawaii medical student. You're going to have to go home. You can't do this elective. I'm saying to myself, oh my God, busted. He goes, in fact, you see these two guys? They're mad at me because I gave the spot to you. They want the spot. They're Hawaii students. They have to do it. You have to go home. But he was such a nice guy. He said to me, now listen, I know you made this big trip. He didn't know that I stayed in this crazy dormitory, nearly risking my life in that dormitory. And he says, you can spend the morning with me. You can even come tomorrow, but it can't count as you have to go home.
Right.
So he was so sweet because he was the greatest. We read EKGs. I saw some patients. I'd never met a doctor this kind and this sweet in my life before. And he's wearing a Hawaiian shirt with a stethoscope around his neck.
On top of it.
On top of all this stuff. And I'm in this clinic, which was so great. It was amazing. 12 o'clock comes. He says to me, okay, Robert, we're done. I said, that's it? Yeah. I'm going to go home. We only work till 12 and whatever. It was insanity
12
to me.
midnight?
Okay,
Or
12 noon. He was
12
done.
noon.
We're going to have lunch and it's over. Our day's over. He works a half a day or whatever. He says, you can come tomorrow, be with me, but I never had more fun reading EKGs and learning. It was like ripping my heart out, literally, on the cardiology rotation with this guy. So, and I'm in trouble because I have a round trip ticket. I have no money to back myself up. I've already made the designation. Mr. Smarty Pants got outsmarted, right? So now it's noon. I'm eating the peanut butter and jelly sandwich that I made for myself. Crisis, lamenting the crisis. You did it. You look at what you got, yelling at myself almost as I'm eating this peanut butter and jelly sandwich in a room. It's noon, so I'm just there. All of a sudden, you talk about divine, why do I believe in God? For many reasons. Here's one of them. I'm eating the peanut butter and jelly, and all of a sudden I hear, code blue, help, code blue. And I'm eating my sandwich. It's not that far from me. She's yelling code blue. Terrible.
Code blue means what?
It means someone is dying.
Okay.
In a cardiology clinic. As I put my sandwich down, I look, and those two students that he just introduced me to, who were mad at me because I took are running the other way.
Oh boy.
As I peek my head out of the door with the sandwich in my right hand, I make eye contact with this nurse. Please, help. I throw the sandwich down. I go running in the room, and there is a 300-pound Samoan having a Holter monitor. And on the screen, he's in VTAC.
What's that mean?
That means ventricular tachycardia. Means his heart rate does not efficiently pump blood, and he's going to die right now. I look at this. I go, oh, my God. I say to her, get the ambu bag. And I jump, and on the side of the bed, she gets all this. And I punch him in the chest, and I start CPR. She's doing with the ambu bag, trying to breathe him in, and I'm pumping. And all of a sudden, boop, 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 and the rate comes back. She looks at me, and I have already opened people's chests in the ER to squeeze their heart. I go to Colombia with gunshot wounds.
Wow.
This was like a no big deal, but he went for, I got him back into the room. She looks at me, she goes, oh my God, we saved him. I go, yeah, that's the whole idea. She goes, I've never saved anybody before. Oh. I said, well, Mazel Tov, you've now saved somebody. She goes, wow, what's your name? I said, Robert Klapper. She said, who are you? What are you doing here? I said, I'm a medical student. She goes, oh, wow. How long will you be with us? I said, as a matter of fact, they're kicking me out because I'm not from I'm from Colombia. She goes, who told you that? I said, well, I'm here with Dr. Morris. She goes, come with me. She takes my hand. We go out of that room, and he was still there doing paperwork behind his desk. She bangs on the door. Bang, 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 bang. She bangs on the door. He lifts his head. Yes? Dr. Morris? Yes, Gloria? She says. Do you know what this young man just did? He just saved one of your patients' life. She said, and he's telling me you're not letting him stay? Dr. Morris? Honey, he ain't going anywhere. He's staying here. Okay, Gloria, whatever you say. That's exactly what happened.
So you stayed.
And they had a newsletter that they printed. I still have this in my house. Mahalo to Robert Klapper for saving our patient and all the rest of it. He looks at me and goes, I guess you're going to be able to stay. So that afternoon, because I ain't going back to the Buddhist training dorm. I'm going, and I have no money.
Yeah.
So I ask around, and someone says to me, I can't be the only person who isn't from Hawaii. Tell me, did you know anybody? I think there was a guy from Michigan, and blah, blah, blah. Boom, 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 led to another. I get a name. I call this guy. There's a guy on Liliuokalani Street in Waikiki. He's 2 blocks from the beach. He will rent you his couch in his living room to sleep on for $200 for the month.
Wow. I
said, done.
Done deal.
I go meet the guy. He was Chinese Hawaiian. He says to me, so I went back to noon. And he looks at me and goes, okay, Robert, we're done. Go have fun. What do you mean go have fun? We're done. Enjoy. You're here for a reason. I go back, and the landlord says to me, we're going surfing right now. Want to come? I go, yeah. So I get to the beach with him. He has an extra board. This is my surfing lesson. This is in Waikiki, where it's really easy. Just get on the board, paddle with me. We're going to get out to the lineup.
By the way, hold on. You're joking that it's really easy. Waikiki has huge waves, doesn't it?
No.
Oh, okay. This is the other side.
This is the easy side.
Okay,
And, in the summertime, it can be bigger, but this is easy wave.
Okay.
This is March, April. It's like 1 feet, 2 foot, 3 foot at the most.
But you've never surfed.
Never surfed before. So here's my lesson. I go with this guy on his board. We paddle out beyond the break to the lineup at canoes, it's called. We turn the board around. I sit on it, kind of flimsy. He goes, okay, when I tell you, start paddling as hard as you can and stand up. That was my lesson, okay? So this little wave comes. He goes, here comes the wave. Start paddling. And I start paddling as hard as I can. And you feel as you paddle, I don't know if you've ever surfed, but it's as though God taps you on the shoulder and goes, okay, you can stop paddling now. You take your hands up. I got on my knees. I stood up. Big old board. I stood up and I rode the wave. And I remember looking up at Diamond Head and saying, okay, God, here's the deal. I'm going to do your work for the rest of my life. Through these hands, you're going to guide me. But in exchange for that, you got to let me do this. And that is the moment I fell in love with surfing. So people ask me, why are you in LA? Why are you here? Why are you even? The answer is because I get to surf.
So you surf in LA?
I do. In Ventura.
Wow, nice. All right. I know
I'm exhausted.
I know. I can tell you're exhausted. I just, we don't tell a big story, but you do still do your art. You do still sculpt. Yeah. We didn't really get into that. You don't have to go into the big story, but I just want to clarify because people do come to your office and they see sculptures there. Those are yours. You do those. You bring that marble from Italy.
Yep. Through the Panama Canal in a big wooden box. And I work in the same stone that Michelangelo used to make the David. I use the same chisels. I use the hammers. I really don't like using power tools. I want to do it exactly like he does to learn, unlock the secrets of how he made the most complicated human emotion in rock. The ultimate paradox. And what I learned from him is if you take a face and you rotate it this way and this way, two planes, you have taken a rock and shown sadness, Mary losing her son. And he was the greatest artist to show complex human emotions in stone. What do I mean? If you go to the Vatican, you'll see the Pietà. Pietà means pity, sorrow, that he did when he was 20. It's one of the greatest pieces of art ever made. Mary losing her son, giving him, now she's a Christian, giving him to the world. How do you show that? So he tilts her head away from Jesus and her eyes are closed. That's how he shows that sorrow. But if you go in Florence to the Medici Chapel, because he made 4 Pietas in his life. If you go to the Medici Chapel in Florence, there's a Pieta there where Mary is holding Jesus, but he's a baby. It's Pieta, it's sorrow for a woman to lose her son. It's the greatest grief. But if he's an adult, the sorrow of losing an adult son is incredible. But the sorrow of losing a baby to Michelangelo was even more incredible. So carefully look at that Pietà. Here, Mary, again, you have to tilt the head to show sorrow, to give it the emotion. But here he does the opposite. He rotates her head towards Jesus. And because he's a baby, her eyes are open. Who thinks this way? Nobody. Bernini, a better technician, came 100 years later. Rodin, okay, copied Michelangelo. But for me, if you want to understand the journey of life, do what I do. Look at his early sculptures. and follow his life towards 89 years old, 500 years ago. And you will see his invention of Impressionism 300 years before Claude Monet. You'll see his invention of abstract art 400 years before Andy Warhol. He did it and described complicated human emotions in rock. That's why I'm obsessed.
Amazing. Amazing. Well, thank you so much for your time. Thank you so much for your knowledge, your energy. I know you said you're tired, but you have unbelievable energy. Where do you get all that energy?
Because I'm grateful.
Yeah, you are.
That's where it comes from.
All right. Well, I'm grateful for you. Thank you for coming in person
And
to my
thanks for
studio.
doing this.
Yeah.
Thanks for having your podcast.
What's next for you?
Oh, I encourage you and all your listeners to go. August 4th is a big gala. You can come then. But this summer, the La Brea Tar Pits are celebrating the saber-toothed cat. And I have an exhibit at the La Brea Tar Pits because yours truly discovered something in the saber-toothed cat's hip that the paleontologists did not appreciate for over 100 years. I brought the bones to Cedars, got CAT scans, and I showed them something about the saber-toothed cat that they never appreciated. So the museum has now made a big exhibit, and it's the first time you're going to see the Cedars Sinai logo in the museum.
Nice. Okay.
So that's happening this summer. That's what's next.
Okay. I'll have a link to that in the show notes for everyone. And then not that you need any more people coming your way. It sounds like you're really busy, but I think people really, enjoy listening to you, finding you, and, if they need to, coming to see you.
I'm a doctor. That's what I do. That's really what I do because of the art, because of the surfing, because of the science. The number one thing I do is as a doctor. But thank you. Thank you for having me.